You're listening to localwebradio.fm. Community-minded, locally focused.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert, brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and I am your host today, and I am here with Dr. Norm Ickert, director of the Ickert Dental Implant Centre, and today we'll be talking about the clinical examination of the patient, including what areas need to be examined and why, early detection of problems, and how this fits into the diagnosis and treatment plan. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it is great to be talking with you again today.
Thank you, Nick. Glad to be here.
Now, last time we met, we had some renovations happening at your office. I don't know if that's still happening right now, but if it is, viewers should be reminded, listeners should be reminded that that's just people drilling. It's not teeth or anything traumatic.
That's right, Nick. Thank you.
Over the last 4 podcasts, we have discussed the importance of the medical and dental history. What else do you need to do in order to complete the risk assessment, allowing you to develop a diagnosis and a full treatment plan?
Well, Nick, this is a very, very important question because it's all connected to each other. It starts with a medical history, dental history, which helps identify some of these risk factors that I want to talk about today. And then, of course, it carries on with the clinical exam. And finally, with any type of additional tests such as radiographs or models and things like that that we need to come up with an overall diagnosis. But what I do want to say, and it's very important to me, is that I just want to give credit here to credit where it's due, because I just really feel that this really changed my life. And when I got to meet my mentor, Dr. John Kois from Seattle, Washington, who is truly a genius and probably the premier dental mind and educator in the world, and we had the opportunity to be trained and educated by him for the last 20 years and have become very close personal friends, and now have the ability to teach at his center myself. I am just so grateful to him for this entire concept of risk assessment and helping us to really try and truly understand the real essence of what's going on with our patients when they come into our office, so that we can really get a clear image of how to manage and treat them with predictable outcomes. So I didn't want to let this go on any further without just giving a huge thank you to my good friend, Dr. John Kois. Now, after we've gathered all this information and we've heard the patient's chief concern and we've done the medical examination and we've done the dental history, it's time to perform a clinical exam. Now, what the patient doesn't realize that the dental history has already done a great deal of his examination for us, except they've done it themselves. They've given themselves a self-evaluation.
Which of course, is just another reminder about the importance of the patient just providing all of the answers, because they're doing so much of the work.
Absolutely, but it also is a reminder for us as the caregiver to actually read those questions and understand them and clarify them and listen to what the patient is saying, because that's where the real value comes in. And then we start the exam from the outside, and we always start by palpating the lymph nodes that are in our area of expertise along the head and the neck area, and then we check the chewing muscles, and we move. Of course, we look at the joint itself, the temporomandibular joint, and then we move intraorally to check all the mucosal and soft tissues of the cheek, the floor of the mouth, the tongue, the oral pharynx, the tonsils, and the palate. And this is also very important because this is such a mirror of what's going on in the rest of your body. These mucosal tissues will oftentimes indicate diseases that might be happening with a cause totally somewhere else. So that's really important because you know how strongly I feel about early detection. Mm-hmm. So we can never, ever overestimate or ever not do a complete oral exam, because that's the greatest service we can give to a patient if we can maybe help prevent some type of more dangerous cancerous lesion or so in the future. But once we've done that and we move inside the mouth, then we divide the mouth or the entire exam into 4 different categories. And I'd like to describe the first one here. And that's called the periodontal health. And that basically describes the health of the gum and the bone that surrounds your teeth. It's the part of the structure that hugs the tooth and gives it the solid feel and seal. It's a highly complex system, believe it or not. These cells that hug the tooth turn over on a daily basis. They are an immune system that prevents the toxins that exist in our mouths from entering into our entire body through the bloodstream. They are the absolute protection and defenders of our whole overall health, because where else in the body do you have a hard object sticking through the skin, which, if it gets inflamed, allows an entry path for bacteria to the rest of the body. So the teeth and the mouth is such an important aspect of our health. It's highly complex. Now, surrounding these teeth and sitting underneath the gum tissue are hundreds of different bacteria, and these are called biofilms. Biofilms are like a family of bacteria. They hang out together. They communicate together. They support each other. They're synergistic. And these are bacteria that can potentially be the cause for breakdown in this very important attachment system around our teeth. If you happen to be one of the unfortunate 15% of the society that has a genetic predisposition to this autoimmune disease, your body will see these bacteria and it will try to fight them in a way that it actually begins to break down your own body around your teeth. The bone and the gum starts to break down, and you get this pocketing and the looseness of your teeth, and eventually you lose your teeth as a result. So having a good periodontal examination is absolutely critical. It doesn't mean that you have gum disease if your gums bleed. If you have bone loss, that means you have gum disease, or as we call it, periodontal disease. And that disease is virtually, at this point in time, impossible to get rid of. All we can do at this point is try to slow down the progression, and that's why your hygienist asks you to come in maybe on a more frequent basis, either 3 months or 4 months or whatever your situation requires. And again, that is why the risk assessment is so important, because if you're one of those patients that doesn't have any bone loss and everything is healthy, then maybe you only need to be seen once a year. Like, the recall frequency is dependent on your risk assessment. It isn't just because some company has told you to see your dentist twice a year. You should be seeing your dentist based on the frequency that your individual risk determines. And you see, there's other factors that contribute to the gum disease. If you, like I said in the previous podcast, if you are a smoker, you have a much higher chance of gum disease. If you are a diabetic, you have a much higher chance of having periodontal disease. Or if you have any other type of autoimmune disorder, it increases your risk. So it's really important that we combine the medical history together with the dental history and the clinical exam to come up with a treatment plan that can help manage this condition. The other interesting thing is that this disease is actually patient-specific, it is tooth-specific, and it is actually site-specific. In other words, you can have this disease only on one tooth, and not only that, it can only be on one part of that one tooth.
Oh.
It is so complex and so difficult to get a handle on it. So I think that, I get really passionate about this because it has such a bearing on our overall well-being. The other thing that's really interesting is that if you have a history of periodontal disease and now your teeth are removed, you would think that that's great. Now the gum disease is gone. And that's also been proven wrong in the literature, that if you have true periodontal disease, even when your teeth are removed, you still have that biofilm lingering in your mouth for up to 3 years or more. So guess what? That also now becomes a risk factor for dental implant therapy. That now puts the implants at potential risk if you have this kind of condition. So once again, this diagnosis actually helps us in managing our implant patients by ensuring that we do everything possible to disinfect this mouth prior to taking the teeth out and prior to putting the implants in.
Next one is actually my favorite name of all the 4 categories, the biomechanical health. It sounds like a movie.
Wow, okay.
It sounds like the kind of health you'd give to like RoboCop.
Well, I'm not sure if it's that exciting, Nick. It's a fancy word. But really what we're trying to talk about here is what is the structural health of your teeth? And how does the structure of your teeth get impacted? If you think about it, as a young child, possibly you had a cavity. That cavity was filled with a filling. And now, years down the road, that filling starts to break down, and your dentist tells you if the filling is leaky, now you need a larger filling. Now the filling gets a little bit deeper. You come back and you say, you know what, it's a bit sensitive. Before you know it, he asks you for a root canal therapy. And now you have the root canal therapy done, which hollows out the roots of your teeth, takes out the nerve. Sure enough, the pain goes away. But now you've got a hollow tooth with a large hole on the top of it where the filling is. And now they say, well, you know what, really we have to crown the tooth, otherwise this tooth is going to break down. So it started with a filling, then you ended up with a larger filling, then you ended up with a root canal, and now you ended up with a crown. And all of those treatments, although they may sound like they are great treatments, and that's what we do as dentists, but at the end of the day, all of those treatments have weakened your tooth. We've taken tooth structure away from your tooth. And the stalk of that tooth is so much less than it used to be. And so now you combine maybe biting on a hard object, or you have a bit of a grinding habit, or you end up with dry mouth and you get some decay. Guess what happens? That tooth just begins to break off. And I would say the majority of the treatment that we do in our office, because we are an office that does a great number of implants and reconstructions, I'd say the greatest number of cases that we do are on teeth that have failed because of structural compromise. They've been root canaled, they've been crowned, and at the end of the day, they break off at the gum line, and now there's nothing left. So our dentistry is what can cause a tooth to become weak. And of course, dentistry is done for a purpose, for a reason, because there was a problem, and so you can't blame the dentist for doing the treatment, but you pay a price when you have this type of treatment done.
Right.
The other factor is that acid is a huge component for our breakdown of the structural aspect of our teeth. And as I mentioned in a previous podcast, a lot of people have acid reflux, some diagnosed, some undiagnosed, but hydrochloric acid is just such a potent acid, pH of 1, it can basically melt your teeth away within months. The other thing is just diet. It's interesting to note that of all the soft drinks that we have, or the sodas, the one that has the highest acidity and the highest propensity to break down your teeth is Mountain Dew. It's a really super acidic drink that completely take away the enamel, and once you get through the enamel, which is the hardest structure on the tooth and the hardest structure in your body, once you're through the enamel, the next layer is dentin. It's very, very soft, and it'll just basically melt away. It's also interesting that, for example, orange juice is very acidic, and anyone who drinks orange juice on a regular basis can actually cause great damage to their teeth because the acidity in the orange actually sucks the calcium out of the enamel itself. And now there are certain orange juices which are treated in such a way that they put some of the calcium back in at the same time, so it's very important that you choose the right orange juice to drink. But even worse is if you were to drink orange juice and then quickly brush your teeth. That would be like pouring acid over a tile floor and then taking a steel brush and then trying to clean the tile floor. Even the tile floor would start to show the signs of wear and tear. So drinking orange juice or apple juice and then brushing your teeth right after is a recipe for disaster because you get the acid erosion followed by the mechanical abrasion. And that's a bad combination.
Wow. We had to take a quick break, but we'll be right back with Dr. Norm Ickert from the Ickert Dental Implant Centre. And of course, when we get back, we're going to finish our 4 categories of the clinical exam. So don't go anywhere. We'll be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
Take control of your financial future with sound investing with Byron Stryloff, Senior Investment Advisor and Chartered Financial Planner with over 30 years of experience on the Home Channel on localwebradio.fm. To schedule a face-to-face conversation, you can reach Byron at 604-535-3700. That's 604